and it is a non-partisan policy platform. So we'll provide a bit of an overview of that and then calls to action. So I'll just hand it over to you directly, Doris, and we'll get started.
Wonderful. You can go back. You can go back. We will start from the latest to before. So the latest is that I just spoke an hour ago with the Premier in relationship to the concerns of RNAO, the developments that are happening as we speak, the threats that people and organizations have received, and the latest, which is the call to arms by a specific individual that is now being investigated by the police. This is all to say that what RNAO predicted, and people do say that we are ahead of the game always, and unfortunately we are also in this case. And this is why we have been calling for the safe zones, Susan, and I will speak in a little bit about that. Just give me a sec. I have been sounding the alarm for already several weeks that in fact, what we are seeing in the rallies and in the protests is not only frustration with COVID, but it's more serious than that. Not that COVID is not serious enough already. It is my assessment, and I'm speaking more as a sociologist on this than as a nurse. As some of you know, my PhD is in sociology related to issues of power and structures, etc. Is that the organizers of this group, which include, unfortunately, 2 nurses, but also others, have a much bigger agenda than COVID only. And so if people think that this will pass and will go away when the masks and the vaccine and all of that goes away, I have sad news for you, that these are movements that have happened in Europe of extreme right-wing radicalization. These are movements that happen in the US. You saw the worst expression of all at Capitol immediately post-election, soon after post-election. And we are starting to see it here. And what really is an indication that things are worse is that one individual already said, bring arms to the Toronto General Rally. The individual now changed her name, nonetheless, the police already has it. Not that RNAO does not believe on rallies. In fact, we have organized ourselves rallies in the many years that I have been at RNAO, very judiciously and not many, but we have. Rallies and protests are part of democracy and are an important part of democracy. What triggered me first to the concern is where are the rallies organized? And when you look at the crowd, shall I say the color of the crowd? I said yesterday in City News that if this crowd would have been predominantly Black or predominantly indigenous communities, with no second thought, it would have been stopped already. And that's why we know we have systemic racism, because if it had been Black people, by and large, or indigenous people, it would have been stopped, even if it was a relatively quiet protest. And we have seen that happen. It's not far-fetched that they're stopped. But this group is predominantly white for whatever reason, and it's not being stopped. And worse even, while I believe that 80% of the people going to the rally are truly simply people that are frustrated, people that never liked the issue of lockdowns, never liked the issue of masks, either are vaccine hesitant or don't think these are the answers. People, you know, I am pretty sure 80% is people like you and me that don't like the policies that have been taken. I also think another likely 15% is people that, as a result of COVID-19 and the measures that have been taken, lost their job. And then there is the others, and that's what I'm concerned. It's the 1 to up to 5% of white supremacy extremists trying to build their own agenda here in Canada. When you look at some of the threats that I receive on social media, and you look at those people that make the threats, and you look where they belong, it's very clear, including party alignment to the PPC. I am saying this with sadness because when a country has this type of events, one of them dressed like the Ku Klux Klan about a week ago, etc., and now calling to arms, it's like having cancer in society. It spreads if you don't nip it in the bud. You know, when you find cancer and you treat it early on, the person has great chances of living for many, many, many years without the cancer, or the cancer in remission, as we would say. When you don't nip it in the bud early, it spreads, and it spreads sometimes very fast. And that's what we are seeing here. Hence my chat with the Premier, that no, we cannot wait a single day more. We have waited, in fact, too long, 2 weeks already or more. So I am confident that the Premier is reflecting in what I ask, and I do hope he will act very fast. Second, the College of Nurses. As many of you know, we reported the 2 colleagues that were organizing rallies anti-lockdown, when rallies anti-lockdown were against the law because it was mandatory lockdown. And that these colleagues were in a rally in the US the same day or the day before of the Capitol building tragedy. I am not saying they were in that building or not. I have no idea. I wouldn't say yes or no because I don't know. I do know they were in a rally, and we have documentation. We send it to the college. In fact, the documentation was from their own website, where they felt very proud. In that rally where they were colleagues from the US that were basically saying in that rally that patients were put in a ventilator to make money, for hospitals in the US to make money. When you have that type of far-fetched views, fringe views, damaging views for the trust of public during a pandemic, this is not any, just any day, and spreading misinformation, the college should act much faster than what it's doing. If you look, and I am not in purpose going to give the names of these women, nor their group, and I have asked the media repeatedly to please do not give the name or the name of the organization, because all we do is power them more. In fact, they are gaining more people on Twitter, more people on Facebook, and this is how they recruit others, by the way. Okay, no different than any other type of terrorist groups that we have seen otherwise. I'm not saying this group is terrorist, but I am saying they're recruiting people by all of us giving them legs. So we call them now No Name, the No Name group and the No Name nurses, but the College of Nurses knows exactly who we are referring. One of them was fired by London Health Science, and the college cannot continue to have them without any restrictions on their practice in the college site. Maybe today it changed. Up to 2 days ago, that's what it was there. So we have a very difficult situation of a few in nursing that have decided to take things in their own hands and more even organize others that openly have said that they support the PPC. As you know, the PPC has been spreading misinformation ongoingly in relationship to the vaccines and everything else. And it's damaging the nursing profession, needless to say. It's like having a bad apple in the middle of your beautiful apples. It's damaging patient care, because when they do the protest in front of the healthcare facility, sometimes even blocking the entrances, When in Vancouver, a patient needed to get off the car to walk to get the chemo, to access the chemo, when here 2 patients or more perhaps by now cancel their appointments for fear. When you have nurses and doctors and other health professionals that have worked, guys, day in and day out. I don't need to explain to the 70 plus people that are here in the meeting. You know how much you have worked. I know how much you have worked. I know how much I have worked 24/7 too. And I know how my colleagues at RNAO and all the nurses in this province and doctors and RTs and midwives and others have worked to have this aggravation where you're going to work to do your 12-hour shift. You're going already exhausted because some cancel vacations, some cancel days off, etc. You try to sleep before so you can take good care of patients with the knowledge and expertise that you have. And on top of that, you need to suffer the insults and aggravations of a protest in front of the doorsteps of your healthcare facility. That is unfathomable. I mean, I don't have another word to say. That for nurses to be involved in organizing this type of protests in front of hospitals when nurses know how damaging will be for patients, for families, and for healthcare workers is in itself already professional misconduct. In itself, in my view, is professional misconduct because they know they're not protecting the public, which is the role of the College of Nurses of Ontario. So I'm asking through this webinar, and I hope the college is there. I will send yet another email that they listen to us. I ask that all of you send messages to Ann Coglan and the college. Enough is enough. These nurses need to receive at least a disciplinary action, or if possible, all the way to the license. But it is professional misconduct. There is no other way because they ought to know the damage they're causing to the health system, to patients, to families, and to healthcare workers. So what I asked the Premier was safe zones starting now, should have started before. No rallies close to the hospitals or to the schools. I am very, very, very fearful that children will need to see protests in front of their schools. And the type of protest that we have seen already that say profanities, etc. We need to avoid that at all costs. And if people are frustrated, go to Queen's Park. Go to Queen's Park, go to Parliament Hill, go where policies are being made, and do not take the frustration somewhere else. Now, as for the policies themselves, in addition to the safe zones which we are asking, RNAO was at the forefront, and we take pride of that, on the masking, universal masking in indoor places. RNAO was in the forefront of mandatory vaccination for all healthcare workers in all healthcare settings and all educators in all healthcare settings. RNAO was in the forefront of vaccine passport, and we take pride on that because that is based on the best evidence that we have. And yesterday, we issued a statement with the OMA together this time to ask exactly the same: safe zones, mandatory vaccination for all healthcare workers, mandatory vaccination for teachers and education staff, and vaccine passports, unless medical exemption. And medical exemption is few in between. And if you have medical exemption, then a negative test 48 hours before the shift of that nurse or that teacher in a school. Now, let me tell you why we support the hospitals that are taking stringent even actions with mandatory vaccination. Because vaccination is not the same as test. So if you have no medical exemption, hospitals are saying you must get vaccinated, double vaccinated. The only difference between the hospitals and RNAO is that we are not saying fire you. We are saying remove you from direct patient care, put you in an office. Because no, we don't want you next to a patient if you are not fully vaccinated. For those that continue to manipulate the science and say, oh, but you have, you can catch the virus anyways, and you have the same viral load, please go to my pinned tweet, because that is a tweet that has been retweeted by thousands already. The media is using it, and it's the latest evidence. Yes, you can catch the virus. Yes, you have the same viral load, but no, you transmit it for much lesser days. That's what we know today. And also no, you don't end up in an ICU bed for the most. Most of the people in ICUs continue to be the unvaccinated or partially vaccinated. So that's as for the latest on all of this tragedy, because I think COVID alone was a tragedy, guys. I really think COVID alone was sufficient to exhaust all of us. I think COVID alone was enough of an enemy that we need to start create enemies amongst our own people, against patients and against other colleagues. Take your frustration to Queenspark. Leave our hospitals, leave our abortion clinics for that matter, leave our primary care clinics, leave all of the healthcare facilities free of your frustration. It doesn't belong there. It belongs at Queenspark if it belongs somewhere. So that's on this piece, Susan. I need to tell you I'm exhausted. I have been all weekend working 24/7 between trying to push issues at the political level, between answering to incessant media that of course needs to cover and respond to that, trying to make sense of these individuals and coming to the same conclusion. What the government has done in terms of public health policy is the right things to do. Perhaps, if nothing else, too late. They should have done it even before, including the passport. But we stand by all those measures. And if you are frustrated by those measures, take it to Queenspark. Take it to Parliament Hill. Don't take it to our colleagues or patients, because that is unprofessional and that is uncalled for. And that is an abuse of the goodness of our colleagues to continue to work 18 months without vacation and without a day off. And that is the most damaging thing that I can think a nurse can do to a patient that goes to get treatment. So please get out of the way. Go somewhere else to Queenspark and demonstrate democracy there.
Thank you, Doris. I just want to say there have been some comments in the chat box, just kind of echoing that concern and having empathy. One person was just saying, accompanying someone at the cancer center today, and just how would that feel to be blocked with all the other concerns and worries, how that must feel being a patient, to be faced with that added stress. And then in terms of some of the actions by nurses, there was a comment that one of those staff you referred to was fired by employers in Ottawa.
In London Health Science.
Okay. And then just a question.
But Susan, that is correct. But I will repeat the question. And I did write to the college. Where is the college? Why does it take 10 months to actually at least suspend until a full investigation is done?
So Doris, that is a question that one person is asking. Did CNO give any rationale for the slow action? Do you have any insight into that?
We are in the process. Well, to me, I answered that's not good enough. 10 months, when there is an emergency, if the college takes 10 months to deal with an emergency that is causing national damage at this point. 10 months is too much. And I am pretty sure all nurses will concur with me on that. So please write to the college. You have the address of the college, write to the college that we want absolutely action on these nurses that are involved in organizing rallies, that are blocking hospitals, that are not protecting the public, which is the role of the college, and damaging the morale of our own colleagues and all healthcare workers. The college needs to act. Enough of excuses, Susan.
Yeah, and there's agreement. Erin saying she 100% agrees with what you've just said. And Maria is saying that Trudeau is addressing these issues in Vancouver now so that we are being heard.
I know we are being heard, but what we need is to outlaw this protest in any healthcare facility and in the schools. Susan, next will be schools. I can tell you next will be schools. In fact, when I mentioned today to a reporter that next will be schools, you know what the answer was? Wow, Dr. Grinspun, you can predict. Already there was one in Montreal. Can you picture that? Your son or daughter, in my case, my grandkids, needed to see rallies, protest of people that negate the evidence. They shouldn't be seeing any protest in the schools. They can go to protest. My little ones have gone to the, climate change protest, but not next to a hospital, next to a school. That is not okay.
So Doris, that's kind of a segue to some of the RNAO's advocacy for back to school. I just wondered if you wanted to talk about what we have been advocating for and kind of where we're at.
So in relationship with schools, we advocated for, from the beginning, first of all, we advocated for smaller class sizes. That didn't happen. We advocated for physical distance, which goes together with small classes. So that will not happen if you cannot have small classes. And we advocated for better ventilation. And that started in August, a bit too late, but at least started. And I cannot tell you how good is the ventilation in such a short time that they have done. And hence why we also advocated for mandatory vaccination for all healthcare workers. And the other thing is we advocated for mandatory masking, and we got it from first grade to end of high school, but we are actually asking that from 2 years old all the way. And that's what we asked first time. And as you know, last year, that's what happened. Most kids didn't have any issue with the masking. Most of them, in fact, some make fun of it, some love it because it's warmer in the winter, some like the shape, whatever it is, right? But we still will have a problem in daycares and in kindergarten unless there is mandatory masking. And we will have it not now, we will have it end of November and then December, January when it's colder. And I'm pretty sure by then they will say mandatory masking inside for the kids, for the little ones. So, mandatory vaccination, the unions actually in education, I believe all of them or most of them supported that. So even the union supported that, but the government has not made it mandatory, right? So it depends on the boards of education, and some have.
Thanks, Doris. A question. Can I take a question about schools?
Yes, of course.
Yeah. This is from Erin. What are your thoughts on lunch? Masks are great, but with Delta taking masks off for lunch indoors may be a huge source of transmission. Could we at least be eating outdoors through October?
I think that that's a very good idea. That's certainly something that we should be promoting. And put it in the parking lot. Let's talk at the office if we do yet another action alert with what do we want with schools, etc., including the issue of 2 years and up for mandatory masking. And then dating outside, I absolutely concur with you and the colleague that wrote about that. In fact, a lot of the education should be outside as much as possible. For example, choir rehearsal should be outside, not inside. Remember, we are talking aerosols. It's like puff, like cigarette, right? It goes like puff. So if you are doing choir rehearsals, everybody's saliva is going everywhere, right? So that's why we should have prohibited activities like choir inside and do them outside as long as the weather permits. But the lunch, yes, I concur. Any break should be outside, will be a lot better.
Well, thank you, Erin, for that suggestion.
Because we need to remember, Susan, one more thing. We need to remember that, first of all, even amongst the 12 plus, the rate of vaccination is not hugely successful, but below 12, they're not even eligible for vaccine, right? They're not. So what are the ways to protect the kids that are, 0 to 12? Unless 12 is this year in 2021, which they can get vaccinated. But if the 12 is 2022, they cannot. So the only way to protect them is, number one, the mask, mandatory mask inside, right? And as I just said, we only start at grade 1. Second layer, because protection is layers, right? No one thing is full protection. The more layers you put, the better it is. I don't know, Susan, if you still have that slide that I used to tweet at the beginning of the pandemic, like the cheese one, the Swiss cheese one, with
Right.
all the layers of protection. That slide is still totally true. The more layers of protection, the less likely people will get the COVID, right? So the other layer of protection is the mandatory vaccination for teachers and educators, and to increase the vaccination rate of the 12s and up, and hopefully that their parents and their family, as much as possible, are vaccinated. The more people vaccinated in the same family, the less likelihood that one of them will end up in a hospital bed. I hope that helps, Susan.
Yeah, that's good, Doris. And I kind of been getting a sense that people are wanting to rally you. You said earlier that you're exhausted this weekend 24/7. And I just wanted to read from Kathy that she's saying thank you for all that you are doing. And thank you for sharing the updates, and just echoing the sentiment that she can't imagine what nurses would be, how they behave and think in such ways. But just I think people are wanting to show this support for you, because you really have been a relentless advocate. So I just
thank you, Susan. I want to tell to a colleague that you cannot imagine what nurses are going through. I want to tell you that I can, to a certain extent, for 2 reasons. One, because they share a lot with me, our colleagues. They call me, they share, they write to me, so I can. Second, I had the unfortunate situation of working in a war when I was in my 2nd year of nursing school, including opening a unit for soldiers with the so-called moderate injuries. I cannot imagine if going into the hospital, and I was in the dorm, so it was a small walk. But if I had been outside, which later I was, you come to the units fearful of what you will see, especially if you are young, and I was. You come shock shell because you are fearful of your own well-being, and my husband was in the army, so imagine I was, what was going to happen with him. Then one of my colleagues, one of my classmates, her husband died in the front line. So just picture that. This is no different than COVID, guys. I cannot even picture what it would have been if then other colleagues would have been inside blasting me for going to take care of patients, on my way to taking care of patients. Like, that's the piece that is so disturbing to me and to everybody, I think, and that I can relate, because these are colleagues that are giving it their all. They're giving it their all to save lives, to take care of people, to practice based on the best knowledge we have at the time, because we don't know everything, and things still change with this enemy of COVID, right? But on top of that, to need to receive aggravation from colleagues and from people on the public that they may be taking care of them next week. You know what I mean? Sometimes I think, gosh, I wish we could take pictures of all these people and then tell them in an ICU, we told you, yes, we will take care of you. Of course, we will take care of you, but we beg to you. We beg to you to get double bags, and you didn't. Instead, you were on rallies. Like, picture that, right? Picture that, how devastating for our colleagues. And then for their families, for their kids to see how they're treated. Like, these are, you never hear me use the word heroes, but our colleagues are heroes, guys. 18 months. I cannot picture what is 18 months to go like this. 18 months, and they keep going. Every single shift, they keep going, right? And then we are surprised when they say enough of this. I can't do it anymore, right? Enough of this. So let's rally around them. Let's stop these people from bringing their frustration to the workplaces that are sanctuaries. Even in a war, hospitals are treated as a sacred place that no one can bombard, no one can. Here they're bombarding them with wars, with profanities, with obscenities, with sometimes in some places spitting at colleagues or patients for that matter. Where patients need to get off, as you heard, from the car to go and get treatment. Let's stop that, and let's all rally around our colleagues to say thank you and to push the Premier to absolutely prohibit this protest in hospitals and in schools.
Doris, I have a couple of other questions. One of them is asking, what do you think about corporations or companies that are adopting clear and direct rules about mandatory vaccination, but that's not necessarily the case with public institutions? Do you have a thought on that?
Yes, believe it or not, even corporations that I don't think the world of them, some of them, like Chartel with Orchard Villa, I absolutely tip my hat to them on that. On this piece, I believe if we had clear policies, I believe if the vaccination passport certificate, or whatever we want to call it, would have been implemented right away. If the mandatory vaccination for educators and for healthcare workers would have been implemented right away, we would not have had this oxygen time where those doing the protest still are using others for their own agenda, which seldom is the agenda of the vaccination or the mask. That's the excuse. For the organizers, I am saying, Susan. Of course, the great majority come because of the call to action on the issue of the passport, freedom, etc., right? But I absolutely think that it's essential clear policies. The sooner the better, so that people know where we stand, people know that's going to happen, and people have real choices. You don't want to get fully vaccinated and you want to continue to put people at risk? Fine, don't be in the front lines. Go work on an office. There is plenty of work in offices. But if an organization decides to fire those individuals, we will not take any action against that, Susan, because we believe they're on the right to demand full protection of patients at the end of the day. That's what the organizations are for, protection of patients. I do know a person, just so you know, this is not stories, that had cancer and didn't come out of the hospital, not because of the cancer, but because of COVID. And there are many like that. We can't afford that.
Thank you. There's a question about Israel. So in other countries, such as Israel, people are completely COVID vaccinated and they're getting sick and they're requiring a third booster now. Can you speak to that?
Yes, given that I have most of my family in Israel, I can also talk about Chile, which actually is doing fantastic. First of all, in Israel, people are not more vaccinated than us. That's not true anymore. We are amongst the highest, I believe, the second, I think, in the world. Israel is not the first anymore. The third booster is not only in Israel, it's also in the US. In the US, it is because only 50% of people are vaccinated. So at least they want to protect those that are fully vaccinated to continue to be fully vaccinated. And in Israel, and also will happen in here, is because as the months go away, after 6 months, it starts to decrease the effect of the vaccine. It doesn't go completely away, right? And the longer we allow this virus to mutate, the more boosters we will need, right? And so the problem here with the third dose, and please Google my blog. If you Google Doris blog boosters, you will see what our position is. Or if you Google Doris blog vaccine policy, the longer we take to help the entire world to be at least with 2-dose vaccination, the longer it will take for us to end this COVID nightmare, because it will continue to mutate. And those mutations will come to us because of globalization. You see, the Spanish flu lasted 40 years or so, and there was no globalization traveling every day from one place to another. The situation is much more serious now. But the good news is we do have a vaccine. We do know that the mRNA can be modified easily, and we know it's extremely effective. People do not end up in an ICU bed. I shared with my colleagues that I have a family member in Israel, fully vaccinated, very, very cautious of everything, but with underlying conditions, and ended up in the hospital, but 3 days and was out. No ICU, no nothing. Totally fine at home now. That person without the vaccine, Susan, would have died. The person tells you, and I tell you too. So we know it's effective, and what we are asking now in relationship to the booth, to the third dose, is that it be reserved only for people with immunosuppressed systems and people 80 plus, because they usually have more underlying health conditions. But I'm pretty sure they will give it to everybody that it desires in months to come, I'm pretty sure. And if Dr. Fishman was here, he will tell you, as he told me when I asked him about the vaccine, because my sister was asking me this months ago when Israel started to give the vaccine, and my sister is 70. And he said, Doris, if it was me, I would say yes, tell her yes. And I said, yes, of course, to my sister, and she went and got the vaccine, right? But he will tell you, get it if they offer it. And I'm sure many of us will. But from a policy perspective, I think at this point should be reserved only for immunosuppressed and for 80 plus. And where we need to put the focus is actually to ensure that the rest of the world has more vaccines, so we can suffocate this virus, which is the word I've been using from day one. If we suffocate the virus, we will end up faster than the virus continuing to to create the chaos that is creating, first with people that are ill and dying, and second with now this protest that supposedly are about COVID, but I'm fearful it's not only about COVID.
Thanks, Doris. Erin has a question. Erin, we can let you ask your question.
I just wanted to, Doris, I think you're doing awesome work and keep at it. And I also wanted to just say, I listened to a great podcast. It's called In the Bubble. It's an American podcast, but they had this guy who writes for The Atlantic, Ed Young, and he talked about this specific issue with vaccines and boosters. And I think it would be great for people, like my mother is older and I would love for her to get a booster because I don't know if she's, fully covered. But I don't feel right about taking one personally until there are more people protected in the world. It would be great if someone could pull data to say, like it actually, even if you're only thinking of what it means for your immediate family, which I don't think there's anything wrong with wanting to care for and protect your loved ones, it actually does help you and your loved ones better if we vaccinate the world. And the incremental benefit that I get as a healthy 40-year-old with a booster versus someone who hasn't had a single shot yet, the difference, like the benefit versus risk is so stark. I just wish that if we could find and post more information about that, because I think it's hard to sparse through the data. And I think some people just don't think about, one of these variants is not going to crumble with our vaccines that have worked so well. And we are actually serving ourselves and the world better if we just push them out to other people first, in most cases, unless you're older.
It's true, Erin, but you know what's the problem? And I put myself in the shoes of politicians. It's very difficult for politicians to withstand the pressure when they are seeing that in the US, they're giving the third boost. And then 6 months after you get your second one, you will start to say, well, is it whining? And I want it too. And it's really difficult for politicians. And I think this is why I wrote back then the blogs on this, because most people, including the ones that are in these rallies, all they think is about themselves. We don't tend to think about what will get us out collectively of the mess, right? And that's what you are pointing out, what will get us out collectively of this mess. Yeah, the good news, I was talking with a colleague from Peru because I thought a couple of weeks ago, they didn't even have vaccines for healthcare professionals. They are now having more vaccines and they are now able to offer more and more vaccines. So apparently things are getting a bit better, just not fast enough, Erin. So yeah, it's something that could be done. I will check if actually the feds are doing something on that, but likely politically, they will not even use the time for that, right? But WHO probably has something on this area, and maybe you can look into that. And we can too, of course.
I will look into it.
Yeah, thank you.
Jacqueline, do you have a question?
Can't hear. Who is that? Susan, can you hear me?
Jacqueline, we're just seeing if she has a question. Looks like she has a question, but I'm not sure if she's able to unmute. If not, she can put it in the chat box. And I think we are doing really well, Doris, with answering people's questions as we go along. So I don't think there's anything else outstanding right now. Well, let me just see. Okay, I can hear some music.
Hi, yes, sorry, I didn't know if you could hear me or not. I'm having trouble with the iPad. I'm interested in knowing if there's been research done on the difference between getting a third vaccine and having two vaccines and contracting the COVID, and what your protection is like with that.
That's the similar question that Erin was talking, right?
Yes, similar.
Yeah, so Erin, you want to comment? You did already some homework on that. Erin?
I'm sorry. I don't think I have that information available.
Yeah, so that's information that we are trying to secure on what's the added benefit. But we do know that for people with immunosuppressive systems and older people, it's very important to start to get the third dose 6 months after the second dose. Jackie. Hello?
Thank you, Doris. Yeah. So a couple of other questions. One actually from Barbara from earlier. Sorry, Barbara, I forgot to ask that one. And she's just asked, saying that hornets are a concern. We were talking earlier about eating outside for kids. And she was saying, hornets can be a concern. So just to keep that in mind if we are making a recommendation.
Very good.
And Nicole is asking if there are any updates about vaccination for children less than 12 years old.
Yeah, so Pfizer is the one that was very close to, and likely it's going to get approved in the next couple of weeks, no more from the US. And I don't think that in Canada, we will start to see vaccination of younger kids anytime before December or January. Because things take longer here. But it will happen. It will happen, yeah. But we do have for 12 and up, and the uptake is still not where it needs to be. So we have a lot of homework to do, and these protests certainly don't help us do that, right? Not only in the way that of the misinformation, guys, it's also that they take so much energy out of all of us, right? And they take energy also of governments. Instead of staying focused on fighting against COVID, we are now trying to, overcome the misinformation, many of us, right? The government needing to go in many directions, and the public being yet more and more confused.
Doris, this is going back to an earlier discussion, if you don't mind. It's about contacting the CNO. So I just want to let you know that there's been a little bit of back and forth in the chat about people reaching out to the CNO. There was a question wondering, and I'm not sure if this is something we would do or could do, but an action alert to put some pressure on the CNO.
In terms of action alert?
Yeah.
Yeah, I thought about that too. We only have done one time in our lifetime an action alert about the college, and was on the psychotherapy, if you remember, when they didn't basically precluded RNs from being able to initiate psychotherapy, and we won that. I am hopeful that just with letters and emails, we will see some demand, and the fact that I have been saying it in the last few days all the time, also in the media, openly in live interviews. And if some of you can start to also email, that will help. But if that doesn't help, then we will need to do an action alert. My hunch, although the college has not said to me, is that in order to discipline these nurses based on a protest, they will need to probably do some changes in bylaws. That's my hunch, or in whatever acts that the college has. Because remember, for the college, even they didn't want to take a skill mix and staffing ratios or numbers, remember? Many of us know that, because the focus of the college is if you are a threat to a specific patient, right? If you are unsafe practice to a patient. But a patient is not a patient walking into institution, although one could interpret that way, right? That if a patient cannot get in a timely way to an institution because you organize a rally that is in the front door of the hospital, maybe the college needs a bit of help with interpreting what protecting the public is. So my suggestion is, if some of you can start to send emails, I think that will do the message. I just am so concerned of the damage that has been done by these two individuals, the no-name nurses, to our profession publicly, right? Huge damage. That I am concerned that doing an action alert will only add to that discussion because the media right away will become aware, right? So I'm trying to do that without that. Now, I said this to 85 people now, so it's out there in many ways. But please, if you can, please send emails to the college. If they will get enough emails, even from 50 of you, that should be, I think, enough alarm bells for them to go.
Great, thank you, Doris. The questions are starting to really come in now.
Well,
so,
you have 85 people.
Yeah. So just if you could speak about people who are in ICU with COVID, and let's see, looking for data that shows the percentages in ICU that are double vaccinated and their mortality rates. Do you have anything, can you say anything about that, about the data, or maybe where to get data?
As far as I know, first of all, about 80% of people in the ICUs were people that were either completely unvaxxed or partially vaxxed, or now they're calling it status unknown, which is, you know, an interesting way of hiding information in my view. But I will treat them as unvaxxed if they were to tell me I'm not willing to tell you. You know what I mean? And you have COVID. As far as I know, first of all, thankfully, less and less people have died. That's very important to know. But most importantly, I believe nobody that has been fully vaccinated has died, as far as I know. Yeah. And certainly, if you were to compare the two groups, there is no comparison now and before, right?
Yeah, great, thank you. Okay, a question about boosters and a question about rapid tests. So first about boosters. So when we look at booster vaccines, typically they're given several years afterwards, tetanus, 10 years. Why? So why so early? And there's a fear that after the first booster, there will need to be a second, third, and fourth, etc.
Well, first of all, tetanus doesn't mutate, right? So let's start there. That's pretty easy from a scientific point of view. This virus is mutating as we speak, and it's mutating for the reasons that we explained before, that the great majority of the world has not been fully vaccinated or even one dose vaccinated, and therefore the virus continues to go around and around and around and mutates. So, you know, this is more like the flu shot than tetanus, right? Tetanus is a fixed thing, right? Polio is a fixed thing. We eradicated it, so it doesn't mutate. That's the perfect rationale for it. This virus is more like the flu that mutates from year to year, and here even more often because it's a more faster to mutate virus. So then you will need boosters for that simple reason. And will we ever eradicate this virus? I don't think so. Will we need always boosters every 6 months? I hope not. But will we need, like with the flu, once a year? Probably. I wouldn't be surprised. Will I get it every year? Absolutely. I also get the flu. Would I mandate the flu versus this to healthcare workers? No. And we RNAO never recommended to mandate the flu. But we did say that if organizations wanted you to go with the mask, in fact, we would say to all the organizations, tell the nurse if it's coming with the flu and it's not, you know, to actually put the mask on, because we don't want this to be passed to patients. So here we will say the same in the future, right? Either you get vaccinated or you show a proof of negative test because this virus is more deadly, right?
Thank you. That's a helpful answer, Doris. Now about rapid tests, can you speak about the use of or lack of use of rapid tests. They're used in many areas around the world, but we're not implementing them yet in daycares.
Yeah. So we do support rapid tests. I heard yesterday that actually they're not facilitating funding to private schools for rapid testing. I think we should facilitate rapid testing for every organization that needs that. That is basically large conglomerates of people, especially people that are not eligible to a vaccine, which is daycares and kindergartens, right? And then grades first to whatever it is, 12-year-old. So we do support rapid testing. For adults, though, I need to remind you that we also support testing, but it's not the same as vaccination, right? Testing will tell me if you have or don't have COVID. Vaccination will help you not to spread COVID for as many days as if we didn't have full vaccination. At least that's what we know now. If it changes, I will tell you and you will read likely. But also vaccination, not testing, vaccination prevents you from ending up in an ICU bed, which is terrible for you, terrible for your family, terrible for the health system that is losing one nurse from the workforce, and equally important, that pushes a patient with cancer or other condition to again wait for treatment, or again wait for surgery, or again wait for whatever that person urgently needs, right? So for all of the above, while testing is very important, it does not and will never replace vaccination.
Thank you.
Same as for tetanus. It wouldn't replace either, right?
Yeah. Just before we move on from rapid tests, what about whether or not the rapid test can show the Delta variant or other variants? Do you know if we know how effective it is?
The rapid test never has been as effective as your regular test, right? And we know that, right? But when you want to do in mass, that's why they do them more frequently also. So on the Delta variant, we do not have a specific test here for the Delta variant, not that I know, at least we didn't have, maybe we have now. So we knew it was Delta because we knew at the end of the day that most cases that ended up sick were Delta, but not necessarily because I don't think the test was specific to Delta, and I'm not sure it is now, but I will check.
Thank you. We used to talk a lot about masks. Now but we haven't talked about masks in a while. Now there's a question here. Is there literature on higher quality masking in schools, KN94 versus cloth? Yeah,
not only in schools. The CDC came, I believe, with the directions or recommendations that while we then said any mask is good, now I think it said that the higher quality masks are better than others. I mean, I still use the same mask. I actually use the cloth mask for the most, right? I would be happier if I heard that kids 2 and up are using any mask than what specific mask, because remember what we are talking is the interruption of the flow, is the tightness that really matters, right? That you cannot get things around. That's what matters the most. The higher quality masks are tighter, are better, right? But parents, or I don't know who really it's not the people that I know and not in my family, are saying no mask period for kids before first grade. So, it's let's first convince them back on that. Let's first convince the government and Dr. Moore that we should get back into the masking indoors as mandatory for children 2 and up, so that we don't come into November when people will be less outside and more indoors, where the transmission is much faster and much easier, and kids will be without a mask, right? I mean, to get them used to that. I never understood why we took it out, because I tell you, with kids, habit is very important, as any parent or grandparent or uncle or aunt knows, right? Or friend that has kids. And why did we change to then go back is kind of, I'm not sure why we did it. As you remember, someone spoke about Israel. Israel did a big party. The kids were throwing the masks at the break and all together, and it was all over the social media. And then 2 weeks later, they were all back with masks. Maybe they wanted to give them a break in the summer, fine. But I think we should have reinstituted them in November when we started, and we didn't. So my hunch is just watch it come November, mid-end November max, mask will be back on.
Thanks, Doris. I think I've got a good segue question now that will lead to the discussion that we have about our policy platform.
A colleague of ours just wrote about the NYU doctor. Yes, I will look into that. I promise I will look into that for sure, because it's an important area, and I can put something on the blog on that also. Are people reading the blog? Are people still liking the blog? Do people know about the blog?
We can put the link to the blog in.
Well, I would like to get a sense, because if people are not reading, then I can do without. But I am afraid I can't. Here you go.
Yes, love it. Read it every Sunday. Yes, please.
Okay, that's good. If a colleague can write which doctor from NYU, but I absolutely will get working on the issue of the N95 and the surgical mask and all of that. Yeah, so that we are ready for November. Yeah.
Thanks, Doris. So Heather, I know that you're watching the chat box too. I have this question about the most valuable lessons the nursing community has learned from the last 2 years on COVID-19. And I was thinking of asking that, but is there anything before I move to that question that I've missed from the chat box that you've identified?
I don't think I knew you were saving that one. So no, I don't think I've seen anything else. I'm just agreeing with statements that have been made, but I don't see any other specific questions that we haven't responded to yet.
Okay.
And people, Doris, are continuing to say, Doris, that they really appreciate the blogs, and a couple of people that don't know about it. So we'll make sure we put the link in the chat.
Thank you.
Great. So Doris, how about you answer that question?
No, I
almost
want,
2 years.
no.
Okay.
I'm super interested that people write in the chat. Let's give them 2 minutes or 1 minute. What in your view, I think that's a fantastic question. What in your view, well, let's start with us. What has been the most valuable lesson for you as an individual during COVID? Wow, I love that. And then what has been the most valuable lesson for nursing and then for healthcare? How about if we take, or we do it at the next one and people can come prepare, Susan? It will be an amazing different rooms. Like
yeah, and we can really give people time to think about it.
Yeah.
And capture.
We have had another question come in while you've been speaking. I think this is from Jacqueline. Has there been any discussion about telling the public about the percentage of patients that have either had their elective or cancer or other life-saving surgeries canceled? She's looking for ways to share information to persuade people to get vaccinated.
Yeah, I don't know even if it is public. I have been trying to get the full percentage. I don't think that they have made it public, because it would be a political suicide probably of how many people have been canceled or postponed. So I don't know if that figure is public. And also the same related question that has come is how much it costs a patient with COVID. It's huge. It's huge, the cost of a patient with COVID, right? And so people are talking about that as well. The other question is, what's the excess death that we have had? But that we will know only likely next 2 years from now. Like basically what you do is you compare your last year to before COVID, right? So people with cancer, people with heart conditions, et cetera, and I'm sure we have had a lot of excess death that is not related to COVID, people that have died, especially in the third wave when things were canceled. I certainly know of people with cancer that were canceled, right? Postponed, yeah. So, yeah, you can know for sure about the postponement of elective surgeries. And they said, right? They said that we were a 3 years lag. So imagine, obviously not for any surgery or for, depends on what type of surgery. I also need to say good things because it really is encouraging. I am close to a few colleagues that have had a visit of cancer lately. And I can tell you that their treatments were not at all postponed. Maybe for a week, maybe all in all, but for the most, they were not postponed. So when things are serious, usually it's not postponed. But I also know of people in Alberta, especially, that have had cancer, and it is supposedly in early stages, and they have postponed them. So depends how bad the system is. I mean, our system at this point is not collapsing, but Alberta's system was collapsing, guys. Last week already was collapsing. And I don't know if you know the situation in Alberta, but the government has been entangled, Mr. Kenny, in fights with the Medical Association for already 2 years. Is entangled now with the nursing, with the United Nurses of Alberta in terms of negotiations, with QP, with the United Nurses. They wanted first to decrease $3 across the board, the salary. That apparently was stopped, but they wanted also to take the charge nurse out of, they still have their role of charge nurse in every unit. They wanted to take that away. I mean, at the time that things are going this catastrophic, to try to cut anything from the health system is kind of lunatic, right? Ludicrous.
So I guess, Doris, that could bring us to this question about, or to this section today, to talk about the Federal Election Policy Platform. And we've got the 4 main components of the policy platform, is also on the bottom, alerting people to the fact that they can actually read the responses to this policy platform for each from the different political parties. So just wanted to see what you would like to say about that.
So how many people have reviewed the platform? And how about if I ask one of the colleagues online to tell us, what did you find the most inspiring in the platform? And what did you find the most concerning, if anything? I would love to hear from colleagues. Did people have a chance to review the platform? And can anybody comment? Do we have takers in the line or not?
I'm not seeing any hands up yet. People might be going to our website right now to look at the policy platform. Oh, Erin's got her hand up, so go ahead, Erin.
Erin. Go for it.
I only talked because nobody else did. I don't want to.
That's a good thing. Erin, put your mic, put your camera. Or did you? I don't see you. Maybe it's me that.
Can you hear me? I'm on my phone, so it looks weird.
Okay, that's okay.
I'm waiting to pick my kid up from school. I just was surprised. I love the platform, and definitely told everyone I knew about how it just streamlines it if you just want to get to the heart of the issues that matter. To nurses, I was disappointed that some of the parties as of yesterday hadn't even responded. And I think non-response is a response.
Oh, there is.
No?
Yeah, no.
There were parties that had yet to respond. So I was disappointed in that.
So two things. First of all, two responded. And now you reminded me, and that is terrible, that the third one that responded on Sunday, I must not forget, hopefully PG saw it and sent to policy. The third one responded yesterday or Saturday. So we had the NDP and the Liberals responded some time ago already. And the Conservatives responded yesterday.
Yeah, it was, I checked just last night, Doris, and I saw Conservatives, their response. So I think that's...
Yeah, but did you see that on the thing? Did you see that posted?
Yeah, I think I did. So we can, I don't know if we've heard from the Greens.
The Greens have not, but I don't think they will because they don't have a lot of stuff, right? Yeah, I did send that to Madison now to post. I don't think that was posted because I don't think that I had sent it. Not in purpose, of course. I came over the weekend.
Yeah, I'm just on the site right now. We've got posted the Liberal and the NDP waiting for the Conservatives response.
Yeah, but the Conservatives send it also here.
Yeah,
so that's my fault. They send it only to me, you see. And unless PG forwarded, which I probably she has not had time, I just forwarded it now. Very good. So that will be, so three of them, but Erin, two of them were there and the third is now there. I haven't had the chance to look at the responses. I'm curious what they put, but I will, and then on my blog, you guys should read. I also put a fantastic piece on guns because you know that guns has been a big issue during this campaign, right? So I did put a piece about the platforms and guns and an analysis about that, as well as about climate change. Because climate change is a huge issue, right? But climate change we had in our platform also, so.
Yeah, so Nicole says it's on her to-do list, her pre-election to-do list. And I'd also like to encourage people to share it with anyone who's not a nurse or not a member. It's freely accessible, the platform. So it can be really helpful in guiding some of your decision-making.
Very good. So any questions about the platform that you want to put the outline of the platform? Or we let people review it themselves? What would you like to do?
Heather just put it in the chat box, so you can look at it directly right now. And it's organized across, according to those 4 main headings. And then you can see the responses as well. And maybe what I'll do is just go to the next slide that has the action alerts that do tie very nicely also to the policy platform. And those, Doris, did I miss any of the main ones? I think those are the 6 main action alerts that are active right now.
That is correct. And I would love for people to actually activate them, especially in relationship, of course, to the platform, which is critical, right? The nursing home basic care guarantee, although no one promised that, all they promise really is money for PSWs and a little bit of money for nursing, and then to work with the jurisdictions. The opioid crisis, very little we heard about that. But I think you will learn if you look at the platform and then you look at the responses from the three parties, that's the best for you, because you can put it live. Lovely. Let's look at one of them. I want to see how the responses look. I haven't looked how the responses look now that they're posted.
So maybe we'll look at the access to healthcare one.
Yeah, let's do that.
Yeah.
Or the national standards.
Okay, so that's the first item in access to healthcare is implement national standards in long-term care. And then if we scroll down, so those are the other topics as well under that category. And then we can look at the parties' responses. So for party responses to national standards in long-term care, you can see what the Liberals said. We've got, so the Conservatives waiting for response, NDP, and Green, actually. We've got responses from the Green.
Oh, we did?
No.
So we have all of them.
Yeah.
That is amazing.
So Conservatives, that needs to be uploaded, but we have heard from all four.
Beautiful.
Yeah. So that's on that particular topic.
So it should make it, well, first, I shouldn't say it should make it very easy for you. It shouldn't, because you may not agree even with the positions of RNAO, and that's totally correct, totally right to do that. I mean, we are basically doing our positions based on the best evidence that we have of an equity lenses, of a justice lenses, of health for all, basically, right? So we come from that perspective. I think most nurses do, but not everybody, right? So if you differ from anything, that is entirely up to you. But this should, at least, if you're a person that wants to think, okay, how does my professional association line up with what parties are saying and with my own values, that should help. That should be good enough to trigger you to do responsible homework before you go to cast a vote, right? And that's really all we ask. We ask two things: vote, 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 vote. Can only vote once, but vote, vote, vote. And the second, try to vote in a way that you at least did some homework, not just whoever looks better or whoever looks good or whoever smile more or smile less or threw more apples to the other. You know what I mean? At least read those responses of the aspects of the platform that are important to you, and then have an informed vote. And the reason that I added climate change, even though we have it, is because we have it in a relatively small portion. And the article that I put is a very solid one that analyzes all the platforms vis-a-vis climate change. And by the way, doesn't give a winning prize to any party, which is depressing. And the other one is on guns, because without guns, there is, with too many guns, there is no security, and without security, there is no health. So that's why I put that there, and the big debate that was related to guns during the elections, debates, etc., and in between.
Well, I hope I haven't made anyone dizzy, but I've just wanted to kind of give people a sense and scroll through this website to show you how it's laid out, so that you're kind of hopefully encouraged to take a look for yourself. And then let me just see if I can get to the action alerts as well, so that you can find those. So just give me a moment. RNAO action alerts, so that people can see how to find those, how to navigate them on our website too. Yeah, so this is the healthy recovery for all, Doris, that we've just been talking about. And the 3 mandatory asks, and ending the opioid crisis, exempting healthcare workers from Bill 124, global vaccine access, nursing home basic care guarantee. So that's the link there. All I did was Google RNAO action alerts and came to this page. So hopefully you can do that on an ongoing basis, not just today, but just to see what some of the current issues are and how you can contribute to an evidence-based response. Doris, is there anything more that you wanted to say about the action alerts?
No.
We wanted to, in this webinar, to kind of address the calls to action.
Maybe one question, does it back people that we back them with action alerts? If people can, that will be a good poll one day. If people can put yes or no, just so we know. I mean, we find that it's an easy way for us to try to push the agendas. That's the key reason. Second, we find that it really helps, right, to people to stay informed, even if they don't act on the action alert. So can people say yes or no? Does it bug you that we send these action alerts? Yes, no? I'm trying to see.
I'm seeing no, no, one yes, no, love the action alerts, no, yes, send us action alerts, great and informative, doesn't bother me, they're informative. So
Okay.
appreciate the alerts. So
And I think they like the fact that they're also in your blog, but don't mind the reminders.
Oh, I'm glad that they don't mind this in my blog. Thank you. And the reminders, thank you. And for the person that backs you, don't feel bad that backs you. Please, you can always mark in the RNAO form that you don't want to get them. So feel free to, what do you call it, Heather, when people?
Unsubscribe.
Unsubscribe. Please feel free. It's not a must, but it really has a lot of powerful impact. You may want to know that on the last one we sent, what was it? About, honestly, I don't remember anymore. They all look like a melted pot to me. I don't remember if it was the mandatory vaccination or the passport, but people from other professions started to tell us, I don't find myself there. Can you put my profession so I also can sign? And we ended up putting all the RHPA professions there and then other groups. So other organizations now are using our action alerts. So more power to the issue, right?
great, thank you, Doris. You're talking about other professions, and there are some questions, comments in the chat box about PSWs, and we did actually get an email prior to this webinar asking about PSWs and working, looking at regulating them, that there's stories of PSWs being fired and then rehired, and looking for greater accountability, and people feeling kind of like, what can they do when someone is not practicing appropriately, or their concerns. So can you speak to that?
You mean in general, what can they do when someone is practicing? So first of all, PSW.
Doris, I think it's more like, would we be advocating for regulation or?
So number one, Susan, yeah, that's where I was going. PSWs will be regulated now. So you will be able to make same complaints that you make about a nurse, right? And I'm not saying that's good or bad. We didn't support the regulation of PSW. So, this has been in the works for many, many years, and now it will happen. So you will be able to do the same way. And one of the reasons that they regulated them is exactly this issue of the complaints, right? And abuse and etc. Will that solve the issue? Time will tell, right? I think that the same as with our own colleagues, with other workers, I think not always we have the guts to report people, right? Or to take action even ourselves. Like if you see a bad practice on a colleague, do you take that colleague aside and you say, hey, we used to do it this way, we don't do it this way anymore, etc., etc. I hear colleagues saying to this day, just let me do my shift. I don't want to get to talk with that person about their practice because it will be a headache for me, right? So imagine if that's happening, you are also not reporting. And I'm talking about nurses, not only PSWs or, even doctors. So any discipline. So I think my approach to poor practice, and remember, we do the best practice guidelines, so it shouldn't come as a surprise, is always to take it as quality improvement rather than resorting to the thinking of reporting first. So to truly take the time to pull aside that colleague and to tell that colleague, you know, yeah, it's true that we used to do it this way. I remember me, guys, teaching nurses when I was a CNS many gazillion years ago, that you rub the red spot right in the sacrum, because that's what you do if you see a red spot, which we know today is damaging to an nth degree, right? But that's what we knew back then. That was the science back then, right? Decades ago. So is to pull that colleague aside and show even our own vulnerability, like what I just said now, right? And say, you know, I used to practice something that when I realized based on the evidence after, I was totally wrong. And you know about this issue with this, now what we do is tarara. If that person persists in practicing poorly, you pull the person again. And if that doesn't work, you may want to ask a meeting with that person and the unit manager and try to help that person develop a plan to practice based on best practice, not on worse habit. Right? Because usually it's not that the person wants to cause damage, it's that they have really poor habits and have not updated their expertise. And then if all goes bad, well, the manager should report that person, but should take progressive action, right? There is so many more things to do before you report someone, unless you're talking about abuse, which I have seen and which I have fired people for that. I remember vividly at Sinai on the spot, right? On the spot when people have been caught abusing patients. So it depends what we are talking, right? I don't know if that answers the question of the colleague that asked Susan.
I think it does, and I liked how you answer the question. So yes, we can regulate people, but that quality improvement approach and the way you just described addressing the issue with a little bit of compassion and empathy goes a long way. So thank you for that.
And the reality is, Susan, if we will wait always to report the person, just picture how much bad would have happened before, because we didn't have the courage pill to address it. It's not comfortable to address poor practice, guys, right? For anyone. And sometimes we are, you know, when it's an issue of practice, let's say the bed up rather than down and a person fall. Well, that's clear poor practice, right? But sometimes there are other issues that is not black and white, and that is a matter of perspective, person-centered care. Let's take that for a minute. So it could be me that I want to know everything, but it could be the patient next to me that doesn't want to know anything because that's their way of coping. So Susan may think the person needs to know everything, and I am with Susan as a patient, but the other person doesn't. So you are affronting that person with loads of information that the person is not ready to cope with, right? So some things are less black and white.
Thank you. I think there's just one more question, Heather, unless I've got this, unless I missed something.
No, go ahead.
But, this one's just.
Oh, I like what Julie said. 1 second before we go to something else. Julie, go for it. I think that is so important, and I know I err in not doing it enough. So please share, Julie Ravel. And by the way, if you ever want to know anything about gerontology or older people's care, that's the person you go, Julie. Julie, where are you? You are there? I see your piece in the chat. It's excellent. Is Julie there or no? Maybe. Yeah, she's here. Can you upgrade Julie Ravel, Olivia to panelist so she can talk?
Just while that's, we're pulling Julie into the panelist, just in terms of the action alerts, others have had comments, and one of the suggestions we've had is that it would be helpful to be clear which are provincial versus federal action alerts.
Brilliant.
Yeah.
Absolutely, yes. Most of them we do provincial, some of them is a mix.
Yeah.
Like opioids is a mix. But yes, thank you. But what you need to know is that when it's federal and provincial, we always include the Prime Minister and the Premier, or the Minister federally, so we take care of that part.
Mm-hmm.
So it's good that you know, because it will be educational for you. But please know that we know to whom we are sending. Thank you, Heather.
Mm-hmm.
Great. And Julie, you should be able to speak now.
Thank you. Thanks, Susan. Thanks, Doris. I assume you're talking about being able to tweet immediately after assigning an action alert. Yes. So I love that. I love that function. I love that right after I've signed an action alert, I get the prompt to say, share this with others. I don't always do it, but I always endeavor to do it. And I'm trying to be better at that, because I think once we sign it, the impact is just further enhanced by us sharing it with others. So,
and I have the secret for you.
Okay.
You can do the send to others more than once. Even if you signed it, later on, you can go again. So I have on both sides. Some I completely, it's not that I forget, I don't have the time at the minute, even though it takes a second, so it's a poor excuse. The best is to do it right away. You sign and it offers you to send via Twitter or whatever, you just do it. But if not, you can also go after and you can resend as many times. So thank you for reminding us of that feature. It's fantastic.
Oh, and thanks for letting me know that tip. That's great.
Yeah.
Great. Heather, was there anything else? There's just one other question I saw about Doris's opinion for at-home care involving.
Yeah, that was the one I was looking at too. So
yeah.
Tell me the question.
The question is.
Just 1 second. One person WhatsApp me about my tweet. I am putting it here because if one asks, I'm sure more can use it. So that's my Twitter. I'm trying to see what I'm typing. I'm not typing well even because I'm trying to do it fast. And also I will put RNAO, and Julie, you should put yours, and Susan should put yours, and Heather too. And if others want us to follow you, put yours. The more of us that follow others, the better, because it gets legs for the things we tweet. Yes, now I can hear the question.
Okay, so the question is from Laura. What is your opinion on at-home care involving nurses, PSWs? So I think maybe Laura, you're asking about having, care from nurses or PSWs.
Either, I'm not sure I understand the question.
Yes, so Laura, if there's a way that you can just clarify, is it nurses or PSWs you're asking, or?
I think she's asking.
But that's always the case, so I'm still not understanding well the question.
Yeah, I would be.
Maybe you can
here we've got her clarification here. She was wondering about the standard of care, the governing body, and how care is completed in relationship to that question, I believe.
I think, at-home care involving nurses, I guess, compared to PSWs.
Well, it's a different scope, so I'm not sure. I mean, everybody should be providing care according to the standards of care. And I would say standards is the minimum practice. So I would say according to best practices, right? Regardless if you are an RN, an RPN, or a PSW, whether it's at home, in a hospital, in palliative care, or in any care. So is that the question, or maybe you can upgrade the person, or downgrade, or upgrade, or side grade to panelist. So Laura can explain to us a touch more, and we can engage on the.
I asked her about the
because it sounds like a
Or
very
people
important.
who are dying, or the surgical procedures that are getting put off, and the government's not sharing that information.
Laura, could you repeat
He
that?
said, Doris, the president said she thinks it's political suicide. They don't want to release that information.
Yeah, I think we're having difficulty hearing you.
Hello?
Hi, is this Laura?
Yes.
Yes. Laura, can you clarify your question?
Yeah, so I've recently been talking to a few colleagues about at-home care, what they do and things like that.
At home care is a company?
No, just the standard of practice that they do at home. Like
Okay, so
at-home
home care, when they provide home care.
Yeah.
Okay.
I'm currently set to graduate as an RN this year, and so I'm starting to look at different ways of practicing. And I was curious to know, as you're a seasoned nurse, it kind of seems that they go outside of their scope quite a bit more, and that the standard of care isn't necessarily as rigid as it would be in a hospital, and a lot of things slip through the cracks quite a bit more often. And so I was just wondering, what is your take on nurses in at-home care, the different levels of nurses that are typically seen producing at-home care, and things like that, because I personally only have experience in acute hospital settings. And so it just seemed very interesting to hear my different colleagues about where they have been with at-home care.
Yeah, I got confused because you repeat the at home and it sounds like a company. So nurses that provide home care, I get it. I am not surprised that they go off scope more often, because they are put in situations sometimes where they need to provide care, that unless they provide it, the patient will be waiting maybe for 2 more days or who knows what, right? So that's one thing. I'm not surprised. They still, whatever they provide should be based on best evidence and best practice. So if they take the risk to go off scope, which I'm not surprised they do, they better do it according to best practice, because if something happens to that patient, it's their fault, quite frankly, okay? More delicate with PSWs, although I'm not surprised either. I'm not surprised if an agency tries to push PSWs to do activities and practices that are not at all within their scope, because I have seen it in this country and in others. And because the PSW is not necessarily that he or she will want to do that, but there is an issue of power between the agency and the PSW, right? And people want to keep their jobs. Or the patient may be asking, or who knows what's the issue, right? It's very complicated. And yes, it always will be very different than in hospital, where all eyes are on you, right? You're not by yourself in the house of that patient. Look, in this long career of mine, I have seen even more serious things related to home care, and fired nurses related to home care, for going off practice in areas that absolutely they never should have, right? At the end of the day, that person holds a license, whether it's a PSW soon will be regulated, or an RN or an RPN. So they're taking great risk when they go off scope. Does that help?
Yes, it does. And it really helps me to greater understand how the dynamic works with home care nurses and why they may act differently than I have seen in the hospital.
Yeah, and also not only in home care, you will see similar things in long-term care, where the resources of RNs or RPNs are so little that many times PSWs are doing activities that are completely not within their scope, Laura. Is that good? No, I don't think it's good. This is one of the reasons why we're pushing that we need not only the 4 worked hours of care in nursing home basic care guarantee, but it be composed of 20% RN, 25% RPN, and no more than 55% PSW, plus 1 NP for 120 patients, so that really we can increase the quality of care, not only the quantity of care, but the quality of care. So yeah, thank you for bringing that question, because it's very important. Does that say that I will advise to you not to graduate and go right away to home care? No, I wouldn't. You know, this culture, I would say, that we have in Canada, of new grads should not go to an ICU, new grads should not go first to public health or to home care. They should just go to a medical surgical unit, because that's where you learn nursing skills. I don't buy that. I have lived in other countries for many years that a nurse student graduates and goes to the area of practice that they love, and we support them to do excellent work in the area of practice that they love and in the sector that they love. And I think we shortchange nurses by not allowing them to do that, because it also sends a message that you know, long-term care it's that's not where you do nursing, and home care is too independent for you, and you are not enough seasoned and accountable to do that yet. And ICU, oh my gosh, that's too complex for you. I don't believe. I personally, as a CEO for RNAO, I think nursing students should have the menu of opportunities open, and we as a profession and the colleagues in the front lines in whichever sector should be ready to mentor new people in whichever area they love. That's.
Thanks, Laura, for the question, and check out the chat box for some of the other comments related to your question. So thank you so much. And on the slide,
but I want to know if Laura agrees or if she thinks I'm out to lunch, and I feel completely okay to tell me I'm out to lunch, Laura.
I personally have experienced a lot of people telling me, don't bother applying to ICU, don't bother applying to public health, don't go straight into home care, like don't do all these specialized units. And so I have been looking at them, and I agree that, you know, we shouldn't be pushed just to do med surg as soon as we graduate. So I do appreciate that coming from somebody who is as experienced, saying you don't need to start in med surg, because that's definitely what I hear all the time.
So Laura, if you live, well, wherever you live doesn't matter for this. If you are eager to work in home care, I will put you in touch with Shirley Sharkey, or with our colleague Catherine, that is now the president and CEO of another home care agency, big, and with Bayshore, they will take you with the hands full. If you want public health, I know all the chief nurses. I will put you in touch. You do what your heart wants you to do, and then you let your brain go there with you and with the help that all of us will give you. Yeah, So I will, you have let me give you my WhatsApp, because that's the only thing I answer these days. And you WhatsApp me and I will put you in touch, and that goes for any new grad for that matter. Home care is desperate to have people, desperate. Not all, but a lot of their nurses have gone to public health because they get better paid, and to public health. A lot of them, they're so short of nurses in home care that is terrible. But any sector that you want, we will put you in touch with people. So send me a WhatsApp and tell me I'm Laura Sapiano, and here is where I would like to work, and then send your CV and I will put you in touch. Promise that. I promise.
Thank you so much, Doris.
And then 3 years from now, that's the only payback. 3 years from now, you will let us know in a meeting like this how well it went, and demystify things for people, you know?
That is the hope, that I will come back and be able to say, I graduated and I went straight into something that I wanted to do.
Yeah, yeah.
I'm just smiling because I'm thinking Laura must be so glad she asked the question. And the WhatsApp number is in the chat box now. Great. Yeah, so child and family nursing is desperate for nurses right now in home care.
Oh, no.
New
So
grads in
just
public
1
health.
second,
Yeah.
Susan.
Yeah.
So to Catherine, they told parents, I was in 2 interviews on this last week or 2 weeks ago, that for kids with very complex issues, kids with very complex illnesses that go to school, they need to bring a private duty nurse with them, paid by the government, right? That goes through home care. It doesn't go through public health, so it will be St. Elise or Bayshore, any of the agencies. And they were called that they cannot bring the kids to school because they didn't have enough nurses to assign. So you're right. Desperate they are. Desperate. Yeah. Go for it, Susan.
Okay, well, this has been an interesting topic to discuss, and seeing lots of interest in the chat box of kind of endorsing this idea of just buddying up new grads and just new grads being really top notch. So that's good to see.
Julie Ravel, can you share, would you mind sharing with people? Julie Ravel is in our board, that's why I'm calling on her. Would you mind, Julie, to share the motion that passed at the AGM that the board put related to long-term care?
Absolutely. So what we are looking to move forward with is to advocate for mandatory hours spent in undergraduate nursing education in long-term care specifically, recognizing a tremendous need to increase exposure to older people and to support the sector in recruiting people to work in this area, in this specialty area. Oh, yay, Laura had a geriatric placement. Oh, if you ever want to talk geriatrics,
I've never had a geriatric placement before.
Oh, you never did? I'm sorry. Well, I wish you would have. If you're ever interested in learning more about geriatrics, Doris will connect us for sure. Did I capture it, Doris, or was there something else that you were
captured fantastically? And,
yes.
And Laura gave you the perfect answer of why we need this resolution. Yes. Because the reality is that whether you work in a hospital, in home care, or in long-term care, a large percentage of your clientele will be older persons. And the best place where you learn about older people's care is really long-term care, right?
Absolutely.
Hands-on care, as well as supervision of others, as well as many, many practice and leadership traits. So that's why we want it mandatory, Laura.
Great. So Doris, there were 2 things that I wanted to make sure that we talked about before we close, and we've just got a few minutes left. One is Olivia had reminded me that the next COVID webinar is October 4th. So I think that was because maybe of the Thanksgiving weekend. So that's coming up October 4th. And today we had talked about a potential topic about what is kind of valuable lessons for you for nursing and for healthcare. So I think that's a great thing for people to start to think about now, and we'll resurface that for our next webinar. And then the other thing, Doris, that I wanted to just alert people to, and I think Raul Pinto is on the line, and maybe he wanted to say a little bit about our new, I've got it on the slide here, what we call
and maybe he wants to do a
news update.
But also maybe he wants to do a picture for this weekly update, and everybody will look beautiful. If people, meanwhile that he talks, Susan.
Sure. So Olivia, if you can put promote people to panelists, if people want to, you can just put in the chat, yes, and we'll start to promote you to panelists, and then we'll get some pictures on the screen and work on that while Raul, if you're still on the line, Raul, can talk about your update.
Raulito?
Yes, can you hear me?
Yes.
Excellent. Sorry, I was in mute because I was recording part of it or this on Twitter. Hi, everyone. I'm, as always, enjoying this webinar immensely. So thank you so much. This is, well, you guys know how important this is for all of us to hear, for the public in general. So this is really great. And thank you for everyone for doing this. So we have this weekly news update that we have been doing weekly, of course, and trying to capture some of the important news related to health, related to government policies talking about health, and also current affairs, as well as RNAO's events. So yeah, you guys didn't tell me you were going to do this. Thank you for putting it up. And you can check, of course, in our Twitter account, or Facebook, Instagram. We have a lot of content every day. So I invite you guys to see it, to tweet it, to share it, because we do it with a lot of love for everyone. So are we showing the video right now, or are we doing the picture?
Show the video first.
Okay, I think you guys have it.
So they know how much they need to smile, depending on what you show.
You guys have it there, right, Susan? You got it right?
I do not. That was just a screenshot, actually, Raul.
Okay. Yeah. Okay. So if I share the link, do you think you could share it?
Let's try that. We'll see.
Because usually, for some reason, it doesn't work from here. Just give me a second.
Sure.
I'm gonna share the link with you guys.
And Olivia, while I'm doing that, are you able to promote people?
Yes, I've promoted a few, but if anyone else wants to join in and be in the photo, please let me know in the chat box.
Just send you the link, Susan.
Got it.
By the way, I wanted to let you know that we were just informed that the conservative response has been posted in the platform.
See, yeah, we put it on the thing already.
This is your weekly.
Sorry.
We're just promoting a few more people, and then we'll take our picture. And in the meanwhile, those people that have been promoted to a panelist and can see their names on the screen, if you could start turning your cameras on so we make sure all works, that would be great.
It says that I'm unable to start my video because the host has stopped it.
Oh, well, okay. Well, that's good to know, Laura. So I'm a co-host, but I'm not the host, so we'll have to figure that out. Just give us a moment. That's why we always want to check ahead of time. Olivia, is that something that I know you're working on?
Yeah, working away on it.
Okay, perfect. Thank you.
Okay, now I think I can do this. Let's see if this.
RNAO News Update.
In lieu of escalating violence at different rallies outside medical centers against mandatory vaccine certificates in the province, RNAO has made.
So the quality of the video is normally excellent, but me sharing it right now is not cooperating. So maybe what we can do is just put the link in the chat box, and then people can see that directly for themselves and watch it every week. Raul, it's coming out every Sunday, is it?
Yes, we're putting it during the weekend. So I think Sunday is the day that we are going to publish.
Sunday at noon.
That's right.
More or less.
Yes, yes, and that's the Twitter, the link for the latest one. So you guys can see it and share it.
Great, thank you, Raul. All right, we're starting to get more faces up here. Catherine, Maria, Kristen, Laura. So Laura, you're the person who's graduating soon. Yay, all right, welcome. Let's see if there are others who want to join and put their cameras on. So Raul, what would you like us to do now that there are some of us on camera?
Yes, so as soon as we got them all on camera, we're gonna do like a pose, right? Like a smile, and then we're gonna take a nice picture, a nice caption for our social media and for our video. Right, yeah, Doris, you know it, like could be a thumbs up, a heart, that's right.
I need to learn how to do that better. Some people know how to do these hearts so nice. And you need to put them on the side, otherwise you cover your whole face.
Some people do the Japanese heart, which is like this.
Yeah, that's nice, no?
Like the heart.
That's also the Chinese we were taught.
Right, well, they say the yes, that's right. Okay, so let me.
That's nice.
So, Jacqueline, are you there? Do you think you could be on camera?
Hey, we have 50 people still.
That's right.
Where are they? You tell us when you're doing this, huh? So we
Looks
smile.
like a few people are having troubles turning their cameras on.
I see. Yes, we have 10 people already, and you look great. Waiting for some people.
Olivia, do we have them blocked? Can we unblock if we have
do
them?
not. As soon as anyone is promoted as a panelist and they are a co-host, which I'm doing for everyone, you should be able to turn your camera on from your own computer screen. So at the bottom of the toolbar, you'll see a camera icon. Just make sure that's enabled. Click start video and you should be able to have your camera on.
You know, I lost the icon that says reactions and you can put a nice heart, but mine is gone.
You'll have to do this one today then, Doris. This one.
You know how to do it here. Okay, teach me. Oh, you do all the fingers. That's why.
Yes.
Okay, now
Kristen's got double hearts. Yeah.
I can't figure out how to turn my camera on.
That's easier. I was trying to do it too, only now I get it.
Oh, there, Barbara, you're on now. Good. Nice to see you. You look like you're relaxing, Barbara, in some nice swinging chair or
in
something.
her garden.
I am. I'm in my garden.
Yeah. Barbara is a big gardener.
We have more people coming in right now.
A few. Oh, I'm going to practice my heart offline here.
Oh, that's good.
Susan gave us a good lecture. with all the fingers. It's easy.
Well, I know, but mine still looks not quite centered.
Then you need to twist your hand.
Okay.
And Nicole, maybe
listen,
put
guys,
on your shirt.
You want
so
to laugh.
your
You
face
want to
too.
laugh. So I'm getting ready for interviews, right? And you kind of try to fix yourself, but you know it goes the opposite. Huh? It goes. If you do this on the camera, is the other side.
Yeah, it's a mirror image. Yeah.
So this is the same, Heather.
Yeah. Okay.
Okay, Doris, are we saying any message, or are we sending hearts to what do you do?
To our colleagues that are being bombarded, please stay. Please stay. We stand by you. Please stay.
Stand by you. Yeah.
Okay. We stand by you. Okay. To our colleagues that are putting up with, you know what? Okay. You tell us.
Yes, I'm already taking the captions.
Okay, we are going to speak, Raulito. So how do we do that?
Okay, that's okay. Let me just start recording this. Just give me one more second, please.
And you say 3, 2, 1, and we go. We
That's
stand
right.
by you.
So I'm gonna do it with my fingers because I need to mute my microphone.
Okay.
Okay.
We're watching.
We stand by you. We stand by you, colleagues. Please stay, we need you. You are the true heroes here.
Thank you, everyone, so much. So hopefully see you on October 4th. And don't forget about our policy platform and our action alerts, and hope to see you again soon.
And Raulito, you can give or you can tweet or you can give to Rene. Thank you, guys. Thank you for all the input, and thank you for raising interesting, important questions that now we need to do more homework.
Thank you.
And Laura, you will send me a WhatsApp with your CV and tell me where you want to work.